Hi friends, let's go for the third lecture of our topic drug absorption and its related physiological factors. I am Harsha. We know that the drug is absorbed through the gastrointestinal tract at various parts like in the sublingual or in the buccal or the rectal route or it may be in the duodenum, but it actually occurs through the passive diffusion. But most of our drug is absorbed through the upper small intestine is nothing but the duodenum. Why the duodenum is more is why duodenum is more responsible for this drug absorption? Because the duodenum has a small tiny projections called villi, and these villi in turn have a small hair-like projections like called microvilli again. So imagine if there is something like a cylinder. If you imagine cylinder as a small intestine, and if that cylinder has a surface area of x, imagine that if the cylinder has something like a structure like villi, it increases the surface area of around 30 times more than that. And this villi in turn have microvilli, so that it more increases surface area, which is nothing which can increase around 600 times. So such a large surface area which helps in the easy drug diffusion and by passive diffusion into the systemic circulation. So the next one, how the gastrointestinal motility happens. When the drug is taken through the oral route and when it is present in the intestine, we do not know exactly where the location of the drug is. We cannot see that, we cannot understand whether the drug is absorbed and how much it is absorbed, and we do not know the exact location. And for a drug to absorb, it should, when the drug is taken through the, or when in the intestine, it should be completely absorbed before it reaches into the feces. So it should have, it should pass through that absorption window. And the gastrointestinal motility also plays a role in the drug absorption. This, in the fasted state, the gastrointestinal contractions are different, and in the fed state, the contractions are different, which is called as migrating motor complex, which actually happens from the stomach to the duodenum. In the interdigestive or fasted state, there is a phase one called a quiescent stage in which it happens for around 30 to 60 40 to 60 minutes 30 to 60 minutes, and here there are no contractions taking place. That's a phase which is a quiet phase with no contractions. Then it starts with the phase 2, which takes around uh, 20 to 40 minutes, in which there are irregular contractions and not much high amplitude, but sometimes it may go to the higher amplitudes, but irregular contraction with with light little bit of smaller amplitude. And then it goes to the phase 3, in which there are regular contractions of the gastrointestinal tract and with higher amplitude. And then it goes to the phase which this phase 3 occurs around 10 to 15 minutes, and then it goes to the phase 4, in which it goes with they would be having irregular contractions and then comes back to the quiescent stage. So this is the condition which we can see in the interdigestive or fasted state. In the fed state, there are regular contractions, but not as high as the amplitude seen in the phase 3 of the fasting state, but with a lesser amplitude but more contractions taking place. So it helps in the food to get propelled from the intestine, from the upper intestine to the continuously to the lower down through the intestine. If you see in this picture, we can see that the contractions take place and then the bolus moves forward. And another factor, which is called gastric emptying time, plays a major role in the drug absorption. Gastric emptying is nothing but you take the food and it goes to the stomach, and from the stomach it reaches the duodenum. The the passage of the stomach food to from the stomach to the duodenum is called the gastric emptying, and the time taken for the gastric emptying time also affects the drug absorption. For example, if there is a reduction in the gastric emptying time, then the drug absorption is reduced because the more of the drug is present on in the stomach, and it may get dissolved, or it may be get disintegrated, or it can be it cannot be used for it may be damaged, and it may not be useful for drug absorption. So, for example, some of the drugs like penicillin and aspirin are affected by are affected by the reduction in the gastric emptying time. And aspirin, when it is taken through the when it is taken with taken when there is a reduction of the gastric emptying time, it dissolves in the stomach itself, and then it irritates the gastric mucosa. And penicillin is not stable in the gastric and in the stomach acid, so it may get degraded. So in that way, the drug cannot be as much effective, and it cannot be absorbed into into the systemic circulation before it reaches the duodenum. So in that way, the gastric emptying affects the drug absorption. So there are some of the factors which influence the gastric emptying time. The volume, the volume of fluid affects the gastrointestinal gastric emptying time. When before the drug is taken, if you just take a more amount of water, that's fine. It may increase the drug absorption, but if you take more of volume of it, more of volume of the food or anything after the drug is taken, so then it may decrease the gastric emptying time. The volume is nothing but is not just it's not water. It may be a cool beverages, soft drinks, or any other, which may decrease the gastric emptying time. And the type of meal is also very important. Fatty acids, the when there is more fatty acid content in the food, then it may decrease the gastric emptying time. Especially the higher carbon chain length of fatty acids have increased increased reduction in the gastric emptying time. So that would decrease the drug absorption, especially the fatty acids which are having the carbon chain length of more than 10 carbons, like decanoic to stearic acids. These are responsible for the reduction in the gastric emptying time. And the triglycerides also play a major role in the reduction of gastric emptying time. Unsaturated fat and saturated triglycerides are more effective in reducing the are effective in this reduce in fact effective in reducing the gastric emptying time. And olive oil and linseed oil are also effective in reducing the gastric emptying time. Carbohydrates also, when when they are taken in higher concentrations, and they reduce the gastric emptying time because of the osmotic pressure. Even the same way amino acids as well, when higher concentrations are taken because of the osmotic pressure, the gastric emptying time can be reduced, and thereby the drug absorption is reduced. So when there is more of osmotic pressure, drug absorption is decreased, and even when the gastric contents are bigger in size. For example, the food which you take is something like a smaller particles, that is fine, and it may help in the increase in the gastric emptying time. But if there is a chunk of material which is high enough, and reduce the that may reduce the gastric emptying time. The chemicals, like for example the acids, also also affect the gastric emptying time. Hydrochloric acid is fine, but when the higher molecular weight of acids are present, they reduce the gastric emptying time, like citric acid, tartaric acid. These are higher molecular weight acids which may reduce the gastric emptying time. Alkali, like sodium bicarbonate, is fine in the lower concentration, so it increases the gastric emptying time. But when it is around 5% of it is present in the stomach, then it may reduce the gastric emptying time again. The drugs like anticholinergics, they decrease the gastric emptying time. Narcotic analgesics, ethanol also reduces the gastric emptying time, but metoclopramide can increase the gastric emptying time. And some of the other factors like body position. If you just lie on to the left side, then the gastric emptying time can be reduced. And the viscosity of the substance which you take, for example, if you take food which is more viscous, then it reduces the gastric emptying time. Emotional states also may play a role here. Emotionally, when the person is aggressive, or if he is active, then he may be having increased gastric emptying. But if the person is depressed, he may have the reduced gastric emptying time. Bile salts also reduce the gastric emptying time, and the disease states, like if the person is having any pyloric stenosis, or if they have pyloric ulcers or duodenal ulcers, they reduce the gastric emptying time. Even hypothyroidism also reduce the gastric emptying time. But in the hyperthyroidism patients, the gastric emptying time is increased. And vigorous exercise, if you do, that may decrease the gastric emptying time. And gastric surgery also can have some of the problems in gastric emptying. And the intestinal motility from the stomach, from the gas after the gastric emptying, it would pass into the duodenum in the small intestine, and the drug which you take, when it goes into the duodenum, into the small intestine, it should be completely absorbed into the systemic circulation, into the whole body, before it reaches to the feces. So it should maintain some of the residence time there. But if a person is having diarrhea, then there is a more of contractions taking place in the small intestine, and then that may lead to the very brief residence time in small intestine. Sorry, in that way the drug absorption is incomplete. Actually, in the normal average study taken when some few years back, the study was taken by using the hydrogen breath test, and which way they noticed that 7 hours is actually taken for a drug to be passed through the small intestine. SIDT is nothing but the small intestinal transit time. So this is just normally done through the hydrogen breath test. Hydrogen breath test is nothing but they give the lactulose through the oral route, and lactulose is fermented in the by intestinal bacteria, and then releases the hydrogen ions, and then these hydrogen ions can be released from the breath, and that way they can estimate that how much of hydrogen is released. But later on, when they studied, and through the gamma scintigraphy studies, they found that The actual SITT is 3 to 4 hours. I will explain about the gamma scintigraphy in the later sections. The drug transit time during the fasting state on an average is 4 to 8 hours, and the drug transit time during the fed state is 8 to 12 hours. And the actual time, the average time taken from the drug to reach to the anus is 53.3 hours. It takes that much of time to reach from the mouth to the anus. Perfusion of the gastrointestinal tract is very important. When you take a drug through the oral route and when it reaches the duodenum, it should pass to the all organs of your body, whatever the target which you intend to take it. So, in order to pass to the all organs, it should have a proper blood supply to the intestines. So, these intestines are supplied with the mesenteric veins. The splanchnic circulation receives around 28% of the cardiac output. So in that way, there is a very huge blood supply. When there is an improper blood supply to the intestinal region, then there is an improper blood drug absorption and thereby decreased efficacy to the patient. And in the disease conditions like in people have sorry who have congestive heart failure, they have improper blood supply to the intestines, thereby when there is an improper blood supply to the intestine, there is an improper drug absorption. Actually, the drug absorption takes place through the mesenteric veins from the intestine, and from these mesenteric veins it passes to the hepatic portal vein and then into the liver, and then from there the metabolism takes place and then passes back to the systemic circulation. And actually, if you look at this diagram here, the mesenteric veins, they pass to the up to the liver near the up to the pancreatic region, and then where the actually it is combined with the splenic vein, and then it is having a common vein passing through to the liver, which is hepatic portal vein, which passes into the liver. In this diagram, we can see that the mesenteric veins are present near the neck of the pancreas, and is actually present to the right side of the left side of the mesenteric artery here. The mesenteric arteries are passed from the aorta. From aorta, it reaches to this all into the intestine. So the intestines are all not only supplied with the arteries and veins, but also with the lymphatic circulation. It is very much supplied to the lymphatic circulation, and the lymph vessels are all present to the intestine, which may help in the drug absorption of mostly the lipophilic drugs. The fat soluble drugs or fatty substances are all absorbed through the lymphatic circulation. The benefit from the lymphatic circulation is that doesn't it bypasses the first pass metabolism. In the mesenteric veins, it flows to the liver and to the enterohepatic circulation, thereby the first pass effect has taken place. But in the lymphatic circulation, that is bypassed and it directly reaches the systemic circulation. Some of the drugs are lipophilic drugs, they are absorbed through this process into the lymphatic circulation. And the effect of food on the gastrointestinal drug absorption. The food when you take, it may have different, it affects the drug absorption. If it is taken, if the drug if it is taken before the meals or if it is after the meals or during the meals, the drug absorption is varied according different conditions. And in the presence of food, the drugs like aspirin, penicillin, isoniazid, etc., these all drugs, they have a decreased gastrointestinal drug absorption. And as I've said that aspirin, when there is a decreased gastric emptying because of the presence of food, and that may irritate the gastric mucosa. And there is delayed drug absorption in the paracetamol, aspirin, cephalexin, etc. when in presence of food. And some of the drugs, they increase, they are in the gastric, the drug absorption is increased in the presence of food, like in the griseofol with metoprolol, oxazepam, etc. These are actually lipophilic drugs. when when there is a food, then that food will stimulate the bile secretion. When this bile secretion is released, it helps in the dissolution of the lipophilic drugs, and thereby it can increase the drug absorption. So this drug rhizophlavin and all these, they are lipophilic drugs, and they help in the drug, they are increased with the drug absorption because of the in this method. And some of the drugs like glibenclamide, metronidazole, prednisone, they are not affected by any presence of food or not presence of food. Some of the basic drugs like cineresin, absorption is increased in the presence of food. You know that basic drugs like cineresin, when the food is present, their pH is decreased so that the pH is increased, sorry, so decreased, so that the basic drug can be easily dissolved. So the drug dissolution is very important here, so that the drug, after the drug gets dissolved, it can easily get absorbed. As I've said that this drug dissolution is very important, and it is always better to the food, take the drug after a meal, and in a in an empty stomach, not in an empty stomach, but after a meal, so that the drug is properly absorbed. Generally, we take 1 hour after the 1 or 2 hours after the meals, and if you take a food which is of high fat content, you may have to wait for 3 hours after the meal, so to take, when you take drugs, that is, and it gets easily drug absorbed into the body. And when you take the drug, it is you have to take at least of 8 ounces of water. So when there is more of water you take when with the drug, then there is a more dissolution, and then the dissolution happens, then the drug can be easily absorbed. And there have been studies that when there is a when there is a less of water taken to the patient with the drug, there is a little dissolution, and then also they may have different side effects. Like for example, if the drug is not dissolved properly, or it may, when you take less of water, it may lodge sometimes in the esophagus or something, and some esophagus, and then it may cause some irritation. Or sometimes when the drugs like some of the antibiotics, they may change the microbial flora inside, so it may have side effects like that. So it is always better to take more of water. And some of the enteric coated tablets also get affected when in the presence of food, when because they reduce the gastric emptying, and they would be staying a lot of time in the stomach itself with the acid, and they, as these are enteric coated tablets and they have a very sustained and slow action, their activity is still decreased, so that the drug absorption is decreased. We know that tetracyclines have a interaction with food and milk. Food and milk may have calcium, so this calcium reacts with the tetracycline. Tetracyclines acts as a chelator here, and then binds to that, and then the drug absorption is decreased. And sometimes we can see the double peak phenomenon. Double peak phenomenon is generally observed in the improper dosage forms, or when there is any faulty dosages. We can see that there is cimetidine of the drug, which can, there is a variability in the drug absorption because of the delay in the gastric emptying. In some of the cases in which the drug, when it is taken, when there is a highly hydrophilic drug is taken, when it gets dissolved in the stomach, when it is dissolved in the stomach, it releases, it gets dissolved, and then that partially dissolved one may get absorbed through the intestine, may partially pass through the duodenum and then have a first absorption peak. And the residual drug which is present, which is not properly dissolved, that may pass to the intestine, that may go through the gastric emptying, and then that may show the second peak, second absorption peak. In that way, there we can see two peaks, which are like a double peaks during this condition, which is sometimes is like an improper, because of the improper dosage form and dosage form. And we can also see this condition in ranitidine. Ranitidine drug, even though if it is given through the oral route or in the parenteral route, it it actually lodges in the gallbladder. It gets deposited in the gallbladder, and whenever the food is taken, and this fatty food or something is taken, when this drug is released from the gallbladder through the bile, and then it shows the absorption peak in the plasma. So in that way, the absorption peak is different. I mean, we can see double peaks, or it may have some other peaks. In this way, you can see that there is an improper drug distribution, even though if you take through the intravenous route. Sometimes the tablet integrity is also important, and it may show some improper drug absorption in the plasma. When the drug when the tablet is improperly crushed or improperly dissolved, and that variability can also show some improper peaks. So this is about the double peak phenomenon. Thank you very much for watching this video. We shall come up with the next chapter, the final one.